I'm Tanya Ross of TDR Academy of Movement and Therapy. This next series of videos that I'm bringing you is to do with the upper limb tension test for the radial nerve. So in terms of it, if you have been experiencing certain symptoms, say for example into the last two fingers, around the middle finger, this may be helpful to you. It may give you some information as to whether there is irritation along that nerve. Again, nothing's ever 100% conclusive, and I would generally say go and see a medical professional if you are getting any sort of nervy symptoms. But this is a self-strategy that you can use that might give you some information and something to work on in the meantime. But also if you've had advice as a reminder of how to perform some of these movements. So with this first test, then what we're going to aim for is just connecting like the finger and the thumb, the index finger. And then you're kind of holding the thumb in as you're making a little bit of a loose fist. So you're holding that thumb in and making a little bit of a loose fist. You're then going to rotate the arm into internal rotation. When the arm is there, notice, do you already feel any nerve symptoms, a tightness, a pins and needles, burning, itching, scratching, anything like that, or particular pain? And whenever you then drop the shoulder down, you're not dropping your body down, you're just trying to sink the shoulder down. Does that make anything worse? If you then lift the shoulder up, does it stop? Then again, you know that there is a link there. We're trying to differentiate between different structures. So when you take it down into that, if that lights it up, it's a positive test, then we know that there is a neural tension within that particular nerve. So you can also add in that position, once you've dropped it down, you could add in the head moving towards the side, which again lets us know if there is a potential link with tightening the tissues between the neck and the shoulder as well. So with the information that you glean from this test, it's giving you an idea whether the nerve is irritated, because when we tension it, some nerves don't really like to be stretched. So whenever they're irritated, that's whenever it gets annoying in the body and they will light up with certain symptoms. So from that point of view, if you're positive, please watch the next series of videos that will give you some movements to try at home to hopefully help alleviate that. And you can always retest again. Go slow, progressive, even in this test, and make sure you've tested both sides. Again, drawing that thumb in and then loose fist, rotate the arm in and then sink it down. You always give it a few seconds, but does it give you any sensations? And if it does, pop the shoulder up. Does it alleviate it? Again, you could pop it down. Does it bring the symptoms in? Does it make it worse as you add in that side flexion of the head? So with these tests, again, just noticing what information that it gives you, and based on that, if you're positive in any way, watch our next series of videos and hopefully they'll give you some help. So yeah, like, subscribe, and yeah, give us a comment. It'd be really helpful to know if you're finding our information useful. And yeah, hopefully we'll see you on the next videos, and hopefully they're useful to you. Thanks for watching.